Hello. For those who are constantly thirsty and wondering what it could be a sign of. Today, many people. What illnesses are indicated by excessive thirst and drinking a lot of fluids? What can help at home, and when should you see a doctor for treatment? We'll cover it all, including what changes occur in the body. We'll also look at the mechanisms behind it all. We'll study this. According to the Mayo Clinic and the American Diabetes Association, based on their data among people with diabetes, 60 to 70% of patients experience excessive thirst and drink a lot of fluids. This need arises. It can persist for several months before the disease is diagnosed, and after it worsens or due to other circumstances. Diabetes may be detected when you visit a doctor. If you've been feeling very thirsty, you should get your blood sugar checked. Blood sugar is checked both on an empty stomach and after eating. In addition to that, a test called glycated hemoglobin is also done. According to an article in the Journal of Diet Therapy from 2022, excessive thirst and drinking a lot of fluids is caused by osmotic diuresis. That is, because the blood sugar level is too high, the kidneys start to excrete it through the urinary tract, and glucose causes water to be excreted along with it. As a result, the amount of water in the body decreases and the blood becomes thicker. The activity of the salivary glands and other fluid secreting glands is reduced. The mucous membrane of the mouth dries out and the body sends a signal saying drink fluids. This signal comes from the brain. When our water level drops, we get the signal to drink water. You drink fluids. Your blood sugar is high because you are not following your diet or your diabetes. You might not even know you have it. You go to the bathroom again and release fluids. You get thirsty again, drink more water, and urinate again. This cycle keeps repeating over and over. The reason could be diabetes. But dry mouth doesn't only happen with diabetes. We'll learn about this now. If someone has a dry mouth and goes to the bathroom a lot and is urinating frequently, they shouldn't get discouraged thinking, I must have diabetes. Dry mouth and excessive thirst can also be seen in other situations. For example, dehydration. If you've been doing intense sports and your body gets dehydrated for a long time, or if certain medications, for example, antihistamines for allergies or medications prescribed by a cardiologist or a nephrologist like diuretics or antidepressants, can cause dry mouth or a feeling of thirst, or a thyroid gland disorder, specifically if it becomes overactive, can also cause symptoms like dry mouth and thirst. Or there is a disease called Sjogren's syndrome. In this syndrome, the salivary glands are affected by an autoimmune reaction, and the salivary glands themselves doesn't function properly and produces less saliva. This leads to dry mouth, thirst, and in addition, chronic stress can also be a factor. Activation of the sympathetic nervous system can cause dry mouth by reducing saliva production and creating a feeling of thirst. Because the system that activates the salivary glands is the parasympathetic nervous system. When the sympathetic nervous system is activated, your saliva production decreases and dry mouth may occur. This was published in an article called Differential Diagnosis of Dry Mouth. According to information from the 2022 issue of the Journal of Clinical Endocrinology, unlike diabetes, eliminating stress or restoring thyroid function, and if there is dehydration, drinking enough fluids will quickly relieve dry mouth and thirst. But in diabetes, this condition does not go away. It can last for weeks or even months. Some people don't pay attention to it, and it can last for years. So how do we get rid of dry mouth? How do we eliminate this symptom? The first thing to do is to bring blood sugar levels back to normal. Dry mouth is a symptom of the disease, not the disease itself. We will discuss these topics separately, one by one. The reason we're covering these topics is because recently, questions about the symptoms of diabetes have been increasing a lot on the internet. So, many people are wondering if they might have diabetes. Or, since November is the month for fighting diabetes worldwide, and screenings are being conducted. Many cases of diabetes are being detected as a result because these people are either suspicious or unsure. They go online, go on YouTube, and search for this information again to confirm it. For example, information like dry mouth is a symptom of diabetes. Besides this information, we will also tell you about its treatment and how you can teach you how to draw conclusions as well. This is what sets us apart from other bloggers. And every one of our articles, every one of our statements, our slides are based on articles and taken from reliable sources. So no one can come in and say this information is false. Because the American Diabetes Association, the Mayo Clinic, or from trustworthy sources like the Journal of Clinical Endocrinology, everything is taken from there. That's what we're talking about. Now, let me show you something. Here, on my YouTube channel, there's a playlist called Interviews with Patients Recovered from Diabetes. You can watch it. An interview with a recovered patient, or there's a playlist called Interviews with Patients Who Achieved Clinical Remission of Diabetes. Here, we've helped nearly 200 patients recover and reach clinical remission, and we've shared interviews with them for your attention. Here, for example, is a patient with 8 years of clinical, has achieved remission. A patient who has suffered from diabetes for 9 years has reached clinical remission. For 25 years, for 13 years. Patients who have struggled with diabetes have achieved clinical remission, and there are videos like these, with nearly 200 interviews. So, what am I trying to say? Does dry mouth go away when blood sugar returns to normal? When glucose normalizes, osmotic diuresis decreases, and you stop losing fluids and salts. The water in your body is restored, and the symptom of dry mouth disappears. This is the first way to eliminate the symptom of dry mouth and thirst. Next, the advice we give you is to drink enough fluids. You should drink between 1.5 to 2.5 liters of water per day. Depending on your body weight, you need to drink 30 to 40 milliliters of fluid per kilogram per day. That is, there are some people who don't even drink a liter of water a day because the weather is cold or they are not very active, since they don't do physical exercise or engage in active physical work. They don't feel the need for fluids, and as a result, they drink very little. These people might often have a dry mouth. Our advice to these people is to drink enough fluids. Drink fluids. Secondly, if you often have a dry mouth, use mouthwashes that do not contain alcohol. There are special products for rinsing your mouth. Rinse your mouth with those regularly. Or use gels and sprays that contain hyaluronic acid. And most importantly, avoid coffee and alcohol. Consuming these products can make your mouth even drier and increase your thirst. In addition, if you develop a fungal infection in your mouth, or if you get stomatitis, you should see a dentist to get special medication for it. You need to eliminate it with the help of special medications. This will also help prevent dry mouth and excessive thirst, as well as their complications. The next step is to seek help from a doctor. In some cases, a deficiency of certain hormones, for example, estradiol or testosterone, or a lack of vitamins or omega-3 fatty acids, can be the cause of dry mouth. For example, when there is a deficiency of estradiol, dry mouth can occur. These hormones are tested, and if a deficiency is found, the underlying cause needs to be treated. This is not something you can do on your own. What you can do independently is rinse your mouth, drink enough fluids, and use hyaluronic acid, using sprays that retain moisture and medications against stomatitis. Normalizing hormone levels should be done under the supervision of an endocrinologist. Our next recommendation is to consume enough green vegetables that retain moisture. For example, cucumber, broccoli, or fruits like avocado. Most importantly, you should avoid salty and smoked foods in your meals. These things can cause dry mouth and increase thirst. According to data from the Nutrients Journal in 2022, when should you see a doctor? First, if all the things mentioned here. If you do all these things but the symptoms of dry mouth and thirst don't go away within 7 to 10 days, then you should check your blood sugar to see whether you have diabetes or not. And the most dangerous situation, the situation when you must see a doctor, is if you notice an acetone smell from your mouth. This could be a sign of diabetic decompensation, and you could fall into a coma. And let me repeat, if your thirst doesn't go away within 7 or 10 days. If you notice an acetone smell from your mouth, or if you develop sores in your mouth, or if you get fungal infections, you should see a doctor immediately. This could indicate that the disease has progressed to a severe stage of decompensation. Today, we discuss the second sign, that is, one of the most common hidden symptoms of diabetes. We have covered the second sign among these kinds of videos. There will be at least 20 such videos. So, we are going through the most common symptoms one by one. We will gradually learn them all. Subscribe to the channel. Watch the other videos. Everything you need is here, whether it's for following a diet or recovering from diabetes. There are videos called Marathon. There are also menus for 3 meals a day, and videos about types of sports you can do with diabetes. There are also videos about biologically active supplements that can quickly lower blood sugar in diabetes. Everything, including supplements, is explained. You should do what your doctor tells you. Follow their prescriptions. Watch the videos on my channel. If your blood sugar drops gradually, reduce it and you will definitely achieve remission. Subscribe to the channel, stay healthy, and take care of yourself. Next time, see you then.